10 years ago, this hospital, Hôpital Sainte-Croix, was one of the 4 best hospitals in the country. This hospital here in Léogâne, Haiti, happens to be a real hotbed for lymphatic filariasis. It's really had a hard time of it since then for a number of reasons, not the least of which was the earthquake in 2010. The epicenter was here underneath us in Léogâne. The influx of foreign aid, of course, was essential and an incredible blessing after the earthquake. But now, 5 years later, almost all those organizations have pulled back. And it's been a struggle for this hospital to get back on its feet. So it's so important that this hospital establish new friendships or renew old friendships with groups like Medi for Help.
Lymphatic filariasis is actually a form of lymphedema that is spread by mosquitoes. It's a parasitic form of lymphedema. So mosquitoes bite a human host, deposit little tiny microfilariae, little tiny worms that basically live, breed, and die within the lymphatic system. In resource-poor nations, what's interesting is typically the treatment is focused on just the hygiene component and some basic education. And what we're trying to do is show you can actually bring modified complete decongestive therapy, inclusive of manual lymph drainage and compression therapies, to these areas and have tremendous success and great patient outcomes.
Stopping new cases is our goal. We expect to reach it by 2020. People with the disease who have it now, though, will, as long as they live, still have to grapple with that disability. And so the work of Medi for Help and others is going to be critical even beyond that goal.
You know what, I think Medi for Help's work here is great. One of the things I got to do is bring a lot of product. And it's easy to say that, you know, obviously there's a cost to it and it takes some effort. And the product that we brought is going to last a long time. Coming here, I thought about the patients and the focus on the patients, but really working with the clinicians and being around them outside the clinic.
We always say that we're not there to give a fish, we're there to teach how to fish. But we also know that now that we're doing this, you take on a fatherly responsibility to these people that you're working with, because suddenly you have given them, the people who work with us, we're talking, you have given them a life that they couldn't have. The other thing that we're thinking about is that we train them over and over again so that the day that we leave, they can be sustainable, they can keep doing what they're doing.
And I think at the end of the day, what we do here is making sure that the Haitian people can take care of the Haitian people.
Et deuxièmement, pour nous contribuer à aider les gens qui sont affectés, les gens qui ont souffert, qui sont rabaissés, les gens qui sont négligés dans la société, dans la population, côté les gens qui ont joué, les gens qui ont dit des mots qui ne sont pas vraiment appropriés. Donc, pour voir comment on peut changer l'état de vie des gens.
You see it laying on with what they're doing with the filariasis. Just a little bit, and not expensive. What we're doing isn't expensive. It has enormous results from the little bit you do. And that just sustains you. I mean, it's amazing what we can do with the little money that we get. It's miraculous. 60 to 80 patients a day.
Et parce que le malade là venu, il est découragé. Moi parler avec elle, moi passer dans tête li, moi caresser li, moi expliquer un peu dans la vie. Moi dire c'est pas fini la vie. Moi faire un peu dans moral là capable de mettre les sous rail là.
We're grateful for anything, but the most important thing is that I trust Medi USA. I have a feeling you're going to be there long after I'm there.
They're bringing hope to Haiti. They're bringing hope to the world. They've brought hope to me. And hope to me is letting go of fear and believing that, the pain will end.